I'm going to make a video right now called Orthomolecular Medicine versus, it's going to be Orthomolecular Medicine versus Schizophrenia. I was inspired because of the whole Georgia Guidestone things, which took me down the whole path of the whole QAnon nonsense and the adrenochrome hocus pocus, if you know what I mean. But Bruce Ames, now this is a website called Found My Fitness, okay? Now Dr. Rhonda Patrick is also on various other platforms, including YouTube, and I highly recommend people follow her YouTube channels. Okay, so this is Bruce Ames on the triage theory of aging and disease, okay? And this is basically a good backbone that gives a lot of evidence, because he did prove this in laboratory research. And I'm not going to play the video because you can go to her YouTube channel and watch the video yourself, or follow this link and watch the video yourself. But what is the triage theory of aging and disease? Well, essentially, Dr. Ames, about his triage theory, blah, blah, blah. When cells run out of a vitamin or mineral, that scarce micronutrient is allotted to proteins essential for short-term survival. Proteins needed for long-term health, including those that protect DNA, lose out and become disabled and lead to diseases, the diseases of aging. In addition, Dr. Patrick and Dr. Ames discuss how RDAs are chosen and what Bruce calls longevity vitamins, which he calls a class of nutrients that exist mostly to prevent degenerative diseases of aging, in addition to essential vitamins and minerals. Before I continue, I want to remind people I'm not a doctor, I'm not a nurse, I'm not a nurse practitioner, not a registered nurse, not a chiropractor, not a nutritionist, not a dietitian. I'm none of that. Don't take health advice from me. Don't take health advice from people on YouTube. But I'm going to explain this. This is vitamin supplementation in the treatment of schizophrenia, and I'm going to skip right to the conclusions. Vitamin supplementation, particularly folic acid, B12, and vitamin D, may play an important role in the treatment of schizophrenia. Now, I want people to understand, they can just click the link in the description and go right to this study. Okay, the treatment of schizophrenia within certain subgroups in those patients who are vitamin D deficient, darker skin, living at altitude with less than blah, blah, blah. Supplementation with vitamin D may be protective among those vulnerable to psychosis. Among those patients with specific genetic variants in folate metabolism, supplementation with both folate and B12 can be beneficial, especially in improving negative symptoms. While there is less compelling evidence for treatment with other vitamins, and even some evidence to the contrary, further studies are necessary to make treatment decisions. A number of questions remain for blah, 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 blah. Okay. The prevention in schizophrenia, the role of dietary factors. Adequate prenatal nutrition is essential for optimal brain development. We all know that by now, okay? There is a growing body of evidence from epidemiology linking exposure to nutritional deprivation and increased risk of schizophrenia. Based on studies from the Netherlands and China, those exposed to macronutrient deficiencies during famine have an increased risk of schizophrenia. With respect to micronutrients, we focus on 3 candidates where there is biological plausibility for a role in the disorder. These nutrients include vitamin D, folate, and iron. Okay, now I'm going to go to the conclusions. Conclusion: evidence from ecological studies has accumulated demonstrating an association with prenatal nutritional deficiency and increased risk of schizophrenia. Other known factors must, however, operate alongside micronutrient deficiency. Otherwise, we would expect it to increased rates of schizophrenia in developing countries compared with it. While there is a lack of qualitative epidemiologic, blah, blah, blah. Okay, in keeping with the findings from nutritional epidemiology, in general, some of the findings suggest a nonlinear relationship. Okay, so a nonlinear relationship between the candidate nutritional agent and the risk of schizophrenia, as has been found with birth weight and infant mortality, but very high and very low levels can be associated with risk. The gold standard evidence will require randomized controlled trials, prenatal nutrition, the falling costs of genotyping. Okay. First, an awareness of the merits of nutritional supplementation and food fortification campaigns in the prevention of other disorders may inspire the research community to recognize the importance of conducting prospective studies of prenatal nutrients in schizophrenia. Prenatal micronutrients in schizophrenia compared with ecological studies related to macronutrition. Investigations that document levels of specific micronutrients are likely to offer more promise with respect. Okay, vitamin D3. The vitamin D3 system is unique in the sense that its production depends primarily on the action of sunlight on the skin. Ultraviolet B radiation reacts on the cholesterol metabolite in the epidermis to produce vitamin D, or pre-vitamin D. Subsequent, the liver turns it into vitamin D, a minor source of vitamin D. The order of biological plausibility of low prenatal vitamin D as a risk factor for schizophrenia. An animal study has been developed in which female rats are depleted of vitamin D prior to mating and throughout pregnancy, but return to normal diet after the litter is born. This model is called the developmental vitamin D deficiency model. Neurobiological findings from these animals include larger lateral ventricles, increased cellular proliferation, reduced apoptosis, altered neurogenesis, persistent ventricular enlargement, hyper locomotion, meaning they move around a lot in novel environments, enhanced locomotion in response to psychomimetic agents, meaning they're acting crazy, increased sensitivity to haloperidol, which is Haldol, and altered attention processing. Epidemiological evidence of vitamin D deficiency in schizophrenia. There is growing recognition that vitamin D deficiency is prevalent in many nations. Pregnant women are also vulnerable to hypovitamosis D, which means that they lack enough vitamin D. Hypo meaning not enough, whereas hyper would mean too much. Ecological studies support a potential role for vitamin D in schizophrenia. These data include studies that have explored the association between schizophrenia and winter/spring birth. People might remember my thing on Down syndrome and folic acid. I did a wonderful video on that, and I would recommend people watch that. I might link it in the description. While the clues from ecological studies make vitamin D an attractive candidate to date, the evidence from analytical epidemiology is modest, and the first attempt to test the hypothesis, finished studies. Recently, a study based on Danish case study examined vitamin D status in neonatal dried blood spots. As expected, the study confirmed that vitamin D concentration showed significant seasonal variation and were significantly lower in the offspring of migrants compared with native-born parents, meaning people with darker skin do not have high vitamin D in European climates. Overall, the risk of schizophrenia was significantly associated with the level of vitamin D, with lower levels of vitamin D, associated with lower levels of vitamin D associated with an increased risk of schizophrenia compared with the reference category. However, the relationship was nonlinear, with the highest quintile of vitamin D also associated with slightly increased risk of schizophrenia. The PAR for vitamin D in this study was 43.6%. Folic acid and homocysteine. Okay, this is important. As discussed, a sharp increase in prevalence. The B vitamins really do seem to have an impact on a lot of factors, probably because of the role they play in DNA stabilization. A wealth of data suggests that folic acid supplementation, either through vitamins or fortified grains, leads to marked decline of incidence and nutritional deficiency, suggesting that a deficit of this nutrient might be responsible for both schizophrenia and nutritional deficiencies. The relationship between maternal levels of homocysteine and an amino acid central to the folate metabolite cycle and risk of schizophrenia in offspring has been investigated. Although folate levels degrade in stored sera, homocysteine represents an excellent proxy given that levels of this amino acid reliably increase when folate levels decline. Moreover, homocysteine acts as a partial antagonist of the N-methyl D-aspartate receptor at physiological glycine concentrations consistent with evidence which may compromise oxygen delivery to the fetus. Okay, so lower levels of oxygen to the fetus increase mental health issues. We all know that. Hence, the relationship between maternal homocysteine and offspring risk of schizophrenia was investigated in the Child Health and Development Study birth cohort in Northern California, which had available archived sera drawn during pregnancy in nearly all members of this cohort. Elevated third trimester maternal homocysteine levels were associated with a greater than twofold increase in schizophrenia. So, elevated third trimester homocysteine levels. High homocysteine means that you're either not getting enough folate or that you need higher levels of folate. You're a special person that needs a little bit higher levels of folate. And that was associated with a twofold increase for the risk of schizophrenia. Iron deficiency is one of the most common nutrient deficiencies in pregnant women, and it's identified as anemia accompanied by depleted stores of iron. Signs of compromised iron supply to the tissues. The main etiologies are inadequate dietary intake on increased requirement for iron, parasitic infections, and loss of blood from other causes. Obviously, menstruation is a common cause in women for low levels of iron, but of course, you don't really need to worry too much about that if you're pregnant, because you wouldn't be menstruating. Another thing is a vegan diet. I supplement with iron. On a vegan diet, I found I've had to supplement with iron. Not a lot. It's just the iron in my multivitamin. Iron is essential. I have to take. What's funny is I actually have to take a women's multivitamin or it's rare that I find a regular multivitamin with iron in it, but I take Centrum one a day, or not Centrum. Centrum women's multivitamins. Iron is essential for a plethora of metabolic processes that are essential for optimal brain function. These include its role as a coenzyme of dopamine synthesis and its relationship to dopamine receptor density. Iron is also an essential cofactor for the synthesis of lipids and cholesterol. This explains disruptions in myelination. That's the insulation of your nerve cells. Okay, that's what myelination means. It's like a wire has that rubber around the outside. Myelination is the fatty acids that surround the nerve cell to protect the transmission of the electrical signal. Perinatal iron deficiency also alters the timing and expression of genes. See, this is what's important. We are, if you remember, I read a book and did a review of a book called True Age by Dr. Morgan Levine. We are starting to see how nutrition affects gene expression, which is very important. And if you notice, and I'll leave a link to various videos by Dr. Joel Wallach, but it's important to understand that that gene expression is not merely what your genetic code is. Nutrition and exercise and not smoking and things like that, they play a very important role in how genes are expressed. So genes that are necessary for the development of the hippocampus, so iron if you don't have enough iron, it can mess up the timing and expression of genes that are necessary for the development of the hippocampus. Animal experiments have confirmed that pre- and perinatal iron deficiency are associated with a range of neurobiological outcomes of interest to schizophrenia, such as working memory, hippocampal size, gene expression, and synaptic plasticity. Synaptic plasticity, or neuroplasticity, is the ability of your brain to change. Okay, to change pathways. Iron deficiency is a risk factor for adverse pregnancy outcomes, including fetal hypoxia, which means a lack of oxygen, hypoxia, lack of oxygen, not enough oxygen. intrauterine growth retardation and prematurity. Moreover, iron deficiency during pregnancy as well as in infancy and childhood has long been associated with motor, cognitive, and behavioral abnormalities similar to those observed in children who later develop schizophrenia. These suggestions led. Why does it say later develop schizophrenia? Schizophrenia is very rarely diagnosed in childhood. That's important to understand. These suggestions led to the first study specifically aimed at evaluating the role of maternal iron deficiency in schizophrenia. Primary preventative approaches, while there remains supporting a role for vitamin D, folic acid, and iron in the etiology of schizophrenia. It is worth noting that the findings reported above on these micronutrients are all based on prospectively acquired data from maternal and neonatal biomarkers and comprehensive follow-up of the offspring for schizophrenia. Nonetheless, of these 3 micronutrients, an attempt to replicate a previous association has been conducted only for iron, hence the following discussion on the documented an association between a prenatal nutrient, let's see here, vitamin D. With respect to the potential links between vitamin D and schizophrenia, more work needs to be, of course. Vitamin supplementation in the treatment of schizophrenia. Okay, schizophrenia is a devastating and usually chronic illness associated with functional disability in social, cognitive, and emotional realms. It is characterized by positive symptoms, hallucinations and delusions, and negative symptoms, emotional blunting and apathy. While positive symptoms often respond to antipsychotic medications, negative symptoms and cognitive deficits do not. Vitamins are organic compounds that are generally supplied in the diet. Many are unable to be synthesized in adequate amounts by the human body. Vitamins are classified as water-soluble and fat-soluble. Most of the 9 water-soluble vitamins act as coenzymes in metabolic vitamins. In this article, we review the literature addressing both vitamin deficiency in the treatment of patients with schizophrenia. Data for the review were obtained at PubMed. Okay, brief historical perspective. While this review focuses primarily on the current body of literature, it is worth putting it into some historical context. One of the earliest investigators to examine vitamin treatment for schizophrenia his name keeps coming up, was Canadian psychiatrist Dr. Abram Hofer, who began his work in the 1950s and was a proponent of orthomolecular psychiatry, which included treating with high doses of vitamins and nutrients. He argued that standard treatment of schizophrenia plus treatment with B3 doubled recovery rates of acute and subacute cases, since vitamin B3 reduced the production of adrenochrome, an oxidized derivative of adrenaline that is neurotoxic. His contemporary Thomas Ban argued against vitamin treatment for schizophrenia. It is replicable in clinic. People don't care about what happens in clinic, I suppose. B vitamins play an essential role in cellular metabolism, including transmethylation and oxidation and reduction reactions. Low blood levels of the B vitamins are a relatively consistent finding in patients with schizophrenia. Low blood levels of B vitamins are consistent in patients with schizophrenia. In a cross-sectional study, Kemperman and colleagues reported low levels of serum vitamin B12 in 61 Dutch patients with schizophrenia when compared to healthy controls. No difference was found in folate and vitamin B6 levels between the groups. In an earlier cross-sectional Okay. There was no adherence in plasma folate and B12 levels between patients. However, among medication-naive first episode outpatients with psychosis in India, plasma folate and B12 levels in patients versus control suggesting an effect independent of antipsychotic medication. Several recent B vitamin supplementation strategies show promise in schizophrenia. Okay, several recent B vitamin supplementation strategies show promise in schizophrenia. In a large double-blind in a small double-blind placebo-controlled study. Double-blind placebo-controlled study showed symptom and social recovery in 17 schizophrenia patients with baseline low folate levels who received daily methylfolate supplementation. That's important to understand. Methylfolate is premethylated, so you can absorb it easier. In addition to standard pharmacologic treatment, in a more recent crossover study, Levine and colleagues demonstrated symptom improvement in 42 schizophrenic patients with elevated homocysteine levels supplemented with folic acid. Remember, you can usually tell if somebody is suffering from folate insufficiency if their homocysteine is high, because folate knocks down the homocysteine. Okay, vitamin B6, and I'm going to get into that when I talk about heart health, when I get into Dr. Kenneth Cooper's book on nutrition. Okay, so vitamin B6 at 25 milligrams a day, so it's folic acid at 2 milligrams a day, not micrograms, milligrams. Vitamin B6 at 25 milligrams a day, and vitamin B12 at 400 micrograms a day. In addition to regular antipsychotic treatment. However, it is not evident from this study whether elevated homocysteine levels are required for the symptomatic benefits of treatment with folate, since all the patients had hyperhomocystemia, meaning high homocysteine. In a small study of 28 patients on a stable dose of antipsychotic medication and call it a symptom response about patients who received folic acid 2 milligrams a day versus placebo. However, among patients with at least one copy of low functioning variant, so they are not good at methylating folate, negative symptoms improved in one large study. The important limitation of the cross-sectional, they always want to point that out. Vitamin D. Vitamin D is a critical regulator of calcium metabolism and also plays roles in gene expression. Vitamin D deficiency has been implicated by several schizophrenia investigators, although conclusions are limited by small sample size and lack of... The problem is actually funding. They're not funding the basic science, actually, is what the primary issue is. Within a cross-sectional study of 102 psychiatric inpatients in New Zealand of 19 patients who had severe vitamin D deficiency, 13 had schizophrenia. So of 19 patients who had vitamin D deficiency, 13 had schizophrenia. Okay, vitamin D, and remember, the people go, well, that's an inpatient mental health facility. People are put in inpatient mental health facilities for a lot of things, not always psychosis and not always schizophrenia. In fact, very rarely, because it's not common. Associated psychosis has been noted in dark-skinned immigrant populations in a retrospective chart review of the 18 first-generation immigrants from Africa and Haiti with acute psychosis. All patients had vitamin D levels in the insufficient range. However, many of the clinical descriptions of the episodes were not consistent with the schizophrenia diagnosis. In crossover, 35 adolescent inpatients, 33.3% of patients were vitamin D deficient. Okay, so among native-born Norwegians with psychosis, 43% had vitamin D deficiency. 43% of native-born Norwegians with psychosis had low vitamin D levels. In a cross-sectional study, 35 adolescent inpatients, 33.7% patients were vitamin D deficient. That's a third of patients were vitamin D deficient. Of those, 40% exhibited psychotic features, compared to 16% of patients who were not vitamin D deficient. So what you're seeing here is 33. Okay, so the ones that were vitamin D, that had sufficient amounts of vitamin D, were less likely to be psychotic. These patients in another small study, vitamin D deficiency early in life may also contribute to schizophrenia risk. Dr. McGrath examined a Dutch cohort of 400 patients with schizophrenia and carefully matched controls with which neonatal dried blood spots had been collected among individuals in the lowest quintiles of neonatal vitamin D. There was a twofold elevated risk of schizophrenia compared to those in higher quintiles. Intervention studies have had mixed results in the Finnish birth cohort of over 9,000 people with vitamin D supplementation with at least 2,000 IUs per day in males in the first year of life reduced the risk of schizophrenia. This is important to understand. Vitamin D supplementation with at least 2,000 IUs per day in males in the first year of life reduced the risk of schizophrenia, of developing schizophrenia by 77% compared to those receiving less than 2,000 IUs per day. These findings did not hold true in females. The authors hypothesized that early vitamin D supplementation is crucial for pro-differentiating signals in the developing brain and potentially also for normal brain recovery after insult, meaning like a shock to the head or something like that. In the study of immigrant populations discussed, vitamin C and vitamin E. Vitamin C and vitamin E are antioxidants that protect against cellular damage due to inflammation or highly reactive oxygen-containing molecules. In a small cross-sectional study among 20 inpatients with schizophrenia and 15 controls, patients had lower fasting vitamin C levels and lower urinary vitamin C excretion. The investigators then examined plasma vitamin C levels in a separate group with schizophrenia versus controls. Vitamin C supplementation, 70 milligrams per day, which is not very high at all. I take 4 grams a day. I take 4,000 milligrams a day. For 4 weeks, in addition to antipsychotic treatment, the plasma vitamin C levels were similar in both groups, but urinary excretion was lower among patient sample. That's because their bodies were using the vitamin C, suggesting an impairment in vitamin C metabolism. In another group, in another small study among 14 inpatients with schizophrenia in India, plasma vitamin E and C levels were significantly lower when compared. Now remember, vitamin C and vitamin E are antioxidants. Antioxidants help to reduce oxidation. Adrenochrome is an oxidized metabolite of adrenaline. One study reported a decrease in the brief psychiatric rating scale, after supplementation with vitamin C, vitamin E, and omega-3 fatty acids. However, given the combination treatment, it is difficult to conclude what effects are due to vitamin supplementation alone. Among those patients with low red blood cell polyunsaturated fatty acids, like what's in canola oil, the vitamin supplementation actually impaired recovery from acute psychosis compared to So this is for people schizophrenia on antipsychotic medication among those patients with low red blood cell count, polyunsaturated fatty acids. Okay, so if you had so this is saying that you probably should take more fatty acids. As we know, PUFAs, polyunsaturated fatty acids, are at risk of oxidation much more than monounsaturated fatty acids or saturated fatty acids, so you need more vitamin E and vitamin C when you take that anyway. They posit that vitamin C may counteract some detrimental effects of vitamin E. Labeled the vitamin C among max dose of 8 grams a day among 13 patients with residual symptoms of schizophrenia despite antipsychotic treatment. 10 of the 13 patients showed improvement. Scores and plasma vitamin C levels increased over the 8 weeks. Now, remind you, that's 8 grams a day. I said I take 4 grams a day. Vitamin C is very, very safe. As I say that, I'm not a doctor, I'm not a nutritionist, I'm not a doctor, I'm not a nutritionist, not a chiropractor, none of that stuff, not a dietitian, whatever. Don't take advice from me. But vitamin C, especially if the dose is broken up, is very safe. The authors report that most of the symptomatic improvement occurred in the positive symptom domain, notably positive symptoms are hallucinations and delusions. So the vitamin C supplementation improved that the most. Notably, there was no control group in this study, and the weekly study visits with medical staff may also contribute to improvement in psychotic symptoms. And prospective double-blind, placebo-controlled study of 40 outpatients in India examined vitamin C supplementation 500 milligrams a day, which is a half a gram a day, for 8 weeks in patients with schizophrenia taking second-generation antipsychotics. The authors found that in the vitamin C group, there was a reduction in serum MDA levels a measure of antioxidants, so it's raising the antioxidant pools. Antipsychotics lower antioxidant pools, just so people are aware of that. An increase in plasma ascorbic acid levels and a decrease in okay. Antipsychotic medications and vitamin C significant increase in it is not clear whether there is some interaction between second generation antipsychotic medications and vitamin C, or if vitamin C acts through another mechanism. The authors propose that vitamin C may inhibit peroxidation. Of course it inhibits peroxidation of phospholipids and act as a free radical scavenger. Of course it acts as a free radical scavenger, that's what it does. Vitamin A is converted to retinoic acid, which plays a critical role, pathophysiology, low maternal vitamin A levels during the second trimester of pregnancy are associated with a threefold increase in schizophrenia. Okay, no association was found during the third trimester. Okay, furthermore, the findings of the elevated homocysteine levels, the conclusions for the future directions, vitamin supplementation, particularly with folic acid, vitamin B12, and vitamin D, may play an important role in the treatment of schizophrenia. Okay, moving on. Ascorbic acid supplementation attenuates schizophrenic-like symptoms in an animal model induced by ketamine. Schizophrenia is a chronic neuropsychiatric disorder with a poorly understood pathophysiology. The theories about the disorder are mainly about dysregulation in one or more systems of the neurotransmitters, and the progression triggers the presence of inflammatory markers. Note, it triggers the presence of inflammatory markers. That's going to come important. You have to remember, a lot of these vitamins are anti-inflammatory in nature, but also what you have to take note of is the polyunsaturated fats, which are anti-inflammatory in nature, which is going to come up in a second. The objective was to evaluate the ascorbic acid supplementation in an animal model of schizophrenia on behavioral parameters and cytokines involved in inflammation, Worcester rats, blah, blah, blah. 4 groups received, Okay, results showed that ascorbic acid supplementation prevented motor sensory loss, but did not alter other parameters evaluated. We concluded that ascorbic acid may be used as a therapeutic adjuvant in schizophrenia and may help improve schizophrenic patients' life quality. So yes, they're admitting that vitamin C may improve a schizophrenic patient's life quality. It's always hard to get 100% with these people, you know what I mean? The impact of omega-3 fatty acids, vitamin E, and vitamin C supplementation on the treatment outcome and side effects in schizophrenia patients treated with Haldol. Okay. Classical antipsychotics like Haldol are suggested to increase oxidative stress. Yes, they do increase oxidative stress and oxidative cell injury in the brain. Pro-oxidant effect of Haldol, that's the chemical name of Haldol, may influence the course and treatment outcomes of schizophrenia. Dietary supplementation of either antioxidants or omega-3 fatty acids was found to improve symptoms of schizophrenia. Thus, the people that did this research decided to assess the impact of combining omega-3 fatty acids, vitamin E, and vitamin C supplementation on the treatment outcome and side effects in schizophrenia patients treated with Haldol. Ongoing Haldol treatment of 17 schizophrenic patients was supplemented with 1,000 milligram capsules of omega-3 fatty acids. That's not a ton, that's one capsule for most brands. Okay. Vitamin E, 400 IUs, again, not very much, and 1,000 milligrams of vitamin C, again, not much. That's not very much at all. These are like one pill. If you're used to taking supplements, it's like one pill each. Patients were assessed with brief psychiatric rating scale for assessing of negative symptoms. Over a 4-month period, glutathione peroxidase, superoxide dismutase, vitamin E and vitamin C levels were also evaluated at baseline, and at the end, at the follow-up visits were significantly lower. Superoxide dismutase level was significantly lower. Our results support the beneficial. Our results support the beneficial effect of the supplementation on positive and negative symptoms. Positive and negative symptoms. So, both on the delusions and the hallucinations, as well as the emotional bluntedness and withdrawal behavior of schizophrenics, okay? As well as the severity of the side effects of Haldol. The effect of supplementation on is especially noteworthy. That's the stuff where you like lock up and stuff. So these supplements actually help with that. And it has not been investigated in previous studies. Excellent. So I started with the triage theory of aging and disease and how that correlates to orthomolecular medicine. And I'm going to end this video with a video clip of Dr. Joel Wallach talking about the 90 essential nutrients that he has discovered. Now, Dr. Joel Wallach is a veterinarian and a naturopathic doctor, and is also the co-discoverer of the discipline known as epigenetics, which is how lifestyle affects gene expression. So let's go with that right now.
The thing we learned in the animal industry over 100 years ago, that to maximize the longevity, maximize the genetic potential for production of milk and meat and eggs, to maximize health, we had to eliminate disease because we don't have health insurance for animals. If we used a human healthcare system for animals, it'd be a sticker shock for most people. A dozen eggs would be $250, and a pound of hamburger would be $700 just to pay for the healthcare. So we learned a long time ago in the animal industry that we could prevent birth defects, we could prevent infertility, we could maximize longevity and health. And
take note of this. You can prevent disease and maximize health with nutrition, with basic nutrients, these 90 essential nutrients that he's going to talk about.
Disease by giving all the known essential nutrients to animals based on body weight. And we learned 100 years ago that there's 16 minerals required, 16 vitamins, 12 amino acids, 3 fatty acids, and that's the 90. And you cannot depend on it from being in your food, because nutritional minerals, which make up 2/3 of the 90 essential nutrients, 60 out of the 90 are minerals, do not occur in a uniform blanket around the crust of the earth. They occur in veins like chocolate and chocolate ice cream, and some places have 10, some places have 15, some places have 20, some places have 40. Plants only need 3 to maximize their benefit and make good seeds for the next generation. Human beings and all other vertebrates, whether you're a hummingbird or a crocodile or an elephant, require 60 minerals. And so the only way you can guarantee that and actually prevent enormous amount of unnecessary misery and cost is to consciously supplement with all 90 essential nutrients. It just seems so simple. You just guarantee it. And whatever you get from your food is a benefit added, is an add-on. But you can't depend what is or is not in the food. And we've learned that in the animal industry, and why not treat humans as well as we do animals?
Exactly. Why don't we treat the humans as well as we treat the animals? I'm going to close out this video on that. I'm going to leave a link to this playlist also in the description. I would encourage people to, of course, do their own research and obviously follow the links in the description. And that's all for this video.